Hello and welcome to SBAH Radio, where we are connecting you to the heart of Steve Biko Academic Hospital. I am your host, Khethiwe Mahlalela, your voice, your story. Joining me today is a special guest from the Department of Environmental Health. Today we'll be talking more about the important role of the Department of Environmental Health and how do they ensure a safe and healthy environment for staff members, patients, and also visitors. As we are aware that environmental health is a crucial field that examines how environmental factors impact human health, emphasizing the need for clean air, safe water, and sustainable practices to prevent diseases and promote well-being. Ms. Frengy Mamogopodi, will you please tell me what differentiates the Department of Environmental Health from the Department of Environmental Affairs?
Okay, I'm going to start with environmental health and then I'm going to move to DFFE. Right? Environmental health focuses on how the environment impacts the public health, right? Our main focus, or the main focus of environmental health, it covers the chemical, the physical, and the biological factors that can cause a detrimental effect on the environment, right? So we, as environmental health practitioners, we are community-based, right? We work closely with communities. That's why you'd find us at a district level or at a municipal level, right? So what we do is that we service communities. We go to different clinics, we go to different hospitals. We also visit creches. We visit food chain stores, right? Your supermarkets, the fast food restaurants, and then we also service the mortuaries, both the public mortuaries and the private mortuaries. So the Department of Forestry, Fisheries and Environment, right, it operates on a national level, right? So now, even though there can be similarities here and there with the Environmental Department, there are also, the difference. But then at the end of the day, we interlink, we work closely together. So DFFE, what they do is that they focus mostly on nature conservation, right? They also work on your the biodiversity, and then they also work on sustainable environmental practice. And what is it that we do in common with DFFE is that our main focus is on climate change, right? One of our scope as environmental health practitioners is air quality monitoring, right? It's environmental monitoring. So now that's where we have the similarities, or we have a common function when it comes to climate change.
So, Ms. Mamogopodi, what exactly is the Department of Health's role here within the hospital, and how do you ensure that the patients and the staff members are exposed to a healthy environment?
Okay, as environmental health, right? Environmental health practitioners, both in our the provincial or the municipal level, right? We are mandated by the Health Profession Council of South Africa, the HPCSA. So we've got our scope of practice that actually govern us, right? So now, environmental health practitioners in the hospital, we work within the jurisdiction of the hospital, right? Yes. But then we still are practicing the scope of practice that other environmental health practitioners or the municipal environmental health practitioners are practicing. So we've got, I'm going to explain our scope of practice as environmental health practitioners in the hospital specifically. So we do waste management, right? We manage the waste in the wards and the waste that is being produced by the public or the visitors when they come into the hospital. We do food safety and hygiene monitoring, right? We've got 3 kitchens in the hospital. We've got 2 cafeterias for the public, and then we've got the kitchen, the hospital kitchen that serves or prepare food for our patients. So now we go in there, right? We do our routine inspection to check the hygiene of the kitchens or the stores, and then we also take food samples and then we submit them to the lab, right? And then from there we'll get the results to show or to ensure that the public always consume safe food at all times. And then we also do chemical safety, right? As we know that we use a lot of chemicals in the hospital, for example, the hand sanitizers, the hand washing liquids, and all the other chemicals that they use to disinfect or to clean around the hospital. So what we do as environmental health practitioners is that we work very close with other departments like the procurement department. We check the material safety sheet, MSDS, right, to check the chemicals, then to also check what detrimental effects can they have on the environment and also on, the people in general, right? So the other thing that we do as environmental practitioners in the hospital, the disposal of the dead, right? Though we're not practicing this on a broader space, as internal environmental health practitioners, we work very close with our municipal environmental health practitioners. Like I indicated earlier, we work within the borders of the hospital. So anything outside the hospital, we have to contact our colleagues in the municipality. So now what is it that we do with the disposal of the dead is, normally what we do is that we go into our hospital mortuary, and then we do the inspection. Should there be anything that has to do with the corpse the corpse in the mortuary, what we do is that we engage with the local authorities, the municipality, and then they come in and then they assist us, and then we take it from there. The other thing that we do as environmental health practitioner, air quality monitoring, like I have indicated earlier on, we work closely with DFFE, right? So now, in this case, as environmental health practitioners, what we do not basically take samples, right? Because you can see that, we've got the boiler house, for instance, we've got the boiler house across the road that belongs to us, right? They use coal. So at the end of the day, we need to make sure that we take samples, right? So now, what we do as environmental health practitioners, we're going to do recommendations after we've done the inspections. And then from there, we're going to get the AIA, right? It's an independent somebody who is a qualified air quality, a specialist. They come through, or even the people from DFFE, they can actually come through and then they take the samples, and then they will tell us as to whether we are above the limit, are we polluting the air or not, right? And then the other scope of practice, we do control of communicable diseases, right? In this case, for instance, this is a public health facility. For instance, we just had an outbreak not long ago, right? A cholera outbreak. A patient is coming from, it happened in Hammanskraal, if my memory serves me very well. They come into the hospital with a cholera, suffering from cholera. What is it that we do is that as environmental health practitioners, we do not work alone. Like we work with different teams in the public health sector. So now we're going to be working with the infection control team. Okay. Should there be any patient who comes into the facility with any form of communicable disease, like cholera, as I've mentioned, what to do is that we're going to get notified as environmental health practitioners to say that there is a patient at a particular ward, they're suffering from cholera. And then what we do as environmental health practitioners, we do an investigation. Like I said to you previously, we work within the borders of the hospital. What we do is that there's a special task team that is organized in the province with environmental health included in the task team. So what we do is that we communicate with our colleagues who are involved in the task team, who are mandated to investigate communicable diseases. So now we take the report of the patient and then we send it to our task team. They are mandated to go out into the community to check what is it that is happening or the source of the outbreak. So in this case, they would know that it's a cholera, and then we would be having information, the address of the patient, when last did they consume the water, and then our colleagues from outside, what they do is that they would take that information and go straight to the patient's residential area, and then they would take the information from there. Our colleagues go as far as going into the water source, right, where the patient consumed the water, and then they take the water samples, and then that's where they're going to establish where is the cholera coming from.
Okay.
And then last but not least, we're also doing education and community development. But then this one is a scope that is being, okay, you know, even us in the hospital, we do that, though we are not going out. But then we also do education and training. We do train our patients. We do train our visitors in a form of awareness campaigns. Like not long ago, there was a hand washing campaign, right? We did distributed pamphlets to our community being the patients and the visitors who are coming into the hospital. We're also doing water quality monitoring. So as a department of environmental in the hospital, we go to different points in the hospital. We randomly select anywhere in the facility to check or to collect the water samples. We're doing the very same thing with what we are doing with the food samples. So now we collect the water sample, and then we take them into the laboratory, and then we get the results from there. We also are taking our infants' milk. We take we know that we've got the milk room in the hospital. So now we collect the milk from the milk room, and then we also, you know, undergoing the same thing.
Okay, thank you, Miss Frengy, for sharing this information with us. So before we close, is there a key message that you would like to share with our viewers and listeners?
Well, there's always a message at the end of the day. You know, behind any communication or, you know, any sort of idea exchange, I believe one needs to be left with a message or something to think about at the end of the day. So now the message from us as the Department of Environmental Health is that environmental health is everybody's responsibility, right? Be it in our communities, be it in our hospital. So now we need to make sure that, or we need to be responsible for our own surroundings, for our own environment. For instance, we must not just litter everywhere, right? We must not just litter everywhere. It causes pollution. So now we know that each and every facility that one goes to, any department, public or private, you would see that they've got different types of bins, you know, to ensure that we do not pollute the environment. So now the message for everyone to take home is environmental health is everyone's responsibility, and we need to conserve the environment for the future generation. I thank you.
Thank you, Ms. Frengy. Thank you also for sharing this knowledge of yours and your insights. And thank you for accepting our invitation to the studio. So for SBAH Radio, I'm Khethiwe Mahlalela. Stay tuned to our SBAH Radio and follow us on our Facebook page at SBAH Radio. Your voice, your story. For now, goodbye.